So the mission of the organization is to protect all children against influenza, and with the ultimate goal of saving children's lives, and with a vision that all families understand the seriousness of influenza. And nothing sort of bothers me more than when I hear people say, oh, don't worry, it's just the flu. Lots of kids die from the flu, lots of adults die from the flu, and as we know from the H1N1 experience, we got away really lucky as a country with that experience. If you think back to 1917 with the Great Flu Pandemic, which was an H1N1 type virus, and more people died from influenza than from war injuries in World War I with that infection. Next slide, I guess. Oh, great. So obviously we're here today to learn about vaccines, specifically with influenza, to understand how serious and unpredictable influenza is, discuss what are the benefits of vaccinating, and really, as most of us are on the front lines from what I gather, how can we as frontline practitioners, you as nurses, me as a physician, work together to make sure that no child dies of a vaccine-preventable disease, and even no human being or no citizen or no person. Let's go. So why I'm here today, that's me, my wife, and my son Nate. And Nate got really, really sick with H1N1. And I want to read a little bit about a diary I took when he got sick. And I want to preface it from before he got sick. So in May of 2009, I just had finished reading the Great Influenza Pandemic book of 1917. My little guy, Charlie, who was about 18 months old, had a typical kid fever. So this is what I wrote. Charlie was recovering from a febrile illness. Question H1N1. I hope not. I'm afraid it is going to be a bad flu season this fall, secondary to liberal use of Tamiflu. I am still questioning what to do with Nate because he has a history of childhood asthma. We decided to get him vaccinated anyway, and he got vaccinated on November 15th. On November 21st, Thursday night, and this I'll continue reading from the journal which I started taking. Where do I begin? Thursday night, Nate began coughing. We thought it was asthma and started him on his nebs. By Friday morning, he didn't seem to be responding very well, looked a little bit worse. My wife is also a physician. I went to work and left her to care for the child. We started increasing the frequency of nebs, and we started giving him some prednisone. By 3 p.m., I was on my way home, stopping at CVS to pick up Pediasure and other sorts of stuff that you give your kids when they have a cold. My wife calls me and says she's bringing him to the pediatrician. He just doesn't look right. While in the pediatrician's office, he had a pulse ox of 80%. The pediatrician gave him oxygen. Didn't even bother calling 911 because she didn't want to delay. Put him in the car with my wife and said, you got to get over to the hospital. Fortunately, we live on Long Island, close to Cohen's Children's Hospital. It was then Schneider's Children's Hospital, Long Island Jewish. And he went over there in pretty severe distress. There was a call ahead to be expecting him. She would come through the ambulance bay. By that time, he was in distress, and while in the ER, continued to receive nebulizers and did not improve. By 7 p.m., he was admitted to the pediatric intensive care with a presumptive diagnosis of H1N1 as the rapid swab done in the pediatrician's office came back positive, and she called ahead to the emergency department to let us know. At 8 p.m., he was in my wife's arms, suffered a respiratory arrest, and was intubated. The next 12 hours were very rocky. He was unable to tolerate the vent, secondary to increased airway pressures. He needed surfactant and an oscillator ventilator, which is a special type ventilator, and that had to be borrowed from a neighboring hospital. Over the next 12 hours, he had bouts of decreasing blood pressures, was started on pressor medications being dopamine, developed a chest tube requiring 2 chest tubes, and basically that was the first 12 hours of his ordeal. For the next 14 days, we sat at his side in the PICU, and it really wasn't until about 3 to 4 days when we knew he was going to survive. No one even told us that. So here I am, an emergency room physician, and I know what it's like when the physicians aren't telling me it's going to be okay. That means they don't know it's going to be okay. And we really thought I would say for the first 3 days, we really thought he was going to die. Fortunately, he recovered. He's 100% well. He's playing ice hockey. He's doing everything that he can do. But it was 14 days when it was questioned whether I was going to lose my son. I don't know if anyone saw Maureen Dowd's article in the Times, her op-ed piece, I think it was last weekend, about the young boy who died of sepsis from bacterial infection. There's not even a word to describe what the human being who loses a child is. We're widows, we're widowers, you lose a mother, you lose a father, that's expected. We don't even have a word in our society to describe what happens when a parent loses a child, because it's not something that we ever anticipate and we can't really describe. Fortunately, I came out through the other side of that due to good luck, and really that's what it was. It was good luck, good doctoring, and you know, I'm happy to say that he survived. But there are, unfortunately, lots of kids who haven't, and we'll talk about, you know, now what's recommended for preventing flu vaccine. So next slide. So what does research show us, and what's the importance of vaccination? Well, and why do we as healthcare providers need to make sure that we educate not only our patients, but also the people in the hospitals and the offices that we work at? There's a strong link between physician recommendations and action to get vaccinated. People can hear their friends talking, but when a doctor says to do something, when the nurse says to do something, it's generally taken more seriously. You can't leave the decision up to your patients. If you rely on your patients to make the decision whether to vaccinate or not vaccinate, they're going to fall prey to some of the publicity that's out there on reasons not to vaccinate. The data and the science is clearly behind vaccinating. There's lots of questions about whether healthy children need vaccination. You need to remind the patients that every season is unpredictable with the flu. There's hundreds or not thousands of different strains, and that all kids greater than 6 months need to get vaccinated. What about vaccine safety? Well, I think there's been lots of talk today about the safety of vaccines and vaccine safety. And in the back of the Vaccine Preventable Disease, the Forgotten Story pamphlet that I think was handed out, there's a great analogy of one of the Mrs. Singer, whose daughter had autism, who's out there promoting the fact that vaccines do not cause autism, that really there's very little science to support that. And the original investigator who started that article actually recanted it, I'm sure, as most people are aware. There's also lack of knowledge that vaccines are the most effective way to prevent influenza. I'm not discounting hand washing. I'm not discounting covering your mouth when you sneeze and you cough. These are all things that we should be educating everybody to do, but that's also requiring everyone to get vaccines. These things are good, but they're not enough to prevent the spread of the disease. So influenza is the leading cause of vaccine-preventable death in the United States. 5 to 20% of Americans are infected with influenza annually. The numbers of people who die from influenza varies between the year, the severity of the circulating virus, and I know that I think the CDC and the World Health Organization have now looked at some of the data from the H1N1 epidemic and really revised the numbers of people who died up much, much higher. Prior to the H1N1 epidemic, 100 children die annually from influenza, so that's 100 innocent children who have long lives ahead of them, whose diseases could have been prevented had vaccination been universal. There's 200,000 hospitalizations each year, and 20,000 children under the age of 5 are hospitalized. There also is an argument which I use all the time when I'm trying to explain the importance of vaccination, which hits the bottom line, which is what unfortunately most people pay more attention to: days lost from work. Large corporations are realizing that influenza costs them money, and that paying for vaccinations is a very cost-effective means for getting the workforce, keeping the workforce healthy. So that's very, very important. Something you could also use when you're out there. I think it's very funny, and I keep going back to this book because I think it was so well done. I really admire the authors because we use the exact same quote. The front page of that pamphlet has the same thing here, and this is something that I learned. So we all like Ben Franklin. There's not too many people who have any bad things to say about him. And Ben Franklin was a proponent of vaccination. His brother was not, and at the time of the smallpox vaccine, Ben Franklin was dissuaded from vaccinating his son Frankie against smallpox. And after the child died of smallpox, this is his comment, in 1736, I lost one of my sons, a fine boy of 4 years old, by the smallpox taken in the common way. I long regretted bitterly and still regret that I had not given it to him by inoculation. This I mention for the sake of parents who omit that operation on the supposition that they should never forgive themselves if a child died under it. My example showing that the regret may be the same either way, and that therefore the safer should be chosen. So if you lose a child from influenza because you did not vaccinate that child, the grief and the guilt that you would have is what Ben Franklin is saying. That's much, much higher and more high risk than not vaccinating. Certainly the safety of vaccinations is clear, and it was in 1736 it was still being debated whether vaccination, or was being debated, and we're still debating it now, almost 200 years later, whether vaccinations are safe. Who gets influenza and how does influenza impact children? Well, anyone can get influenza. If any of you in the audience have had influenza, you know you really don't feel so well. You're sick for 7 to 10 days, high fevers, muscle aches. You may have some GI discomfort. Infection rates are highest among school-age children. They tend to be very close together. They're probably not the best hand washers, and I've seen my kids occasionally cover their mouth when they sneeze, but usually snot sprays all over the place. So with little kids, you can imagine why they all get sick, but we all know that happens. When I was a little kid, and you guys too, you had chickenpox parties where, someone had chickenpox, everyone went over to the person's house because there was no vaccine, so we gave our kids chickenpox that way. And it's because of what little kids do. Younger children, infants, and toddlers are at increased risk of serious complications, and we learned this during the H1N1 epidemic. And again, the preschool age children are the great transmitters of influenza. They host this virus, they spew their snot all over the place, they wipe their hands, they touch the door, and the virus spreads like wildfire. So who should get vaccinated? Essentially everyone greater than 6 months of age and older. And what does that mean? That means you, that means healthcare providers. We are also a very important means in stopping infection. Remember that we take care of sick people, so if you are a carrier of the influenza virus, there's a possibility that you could give it to someone who is at high risk, who maybe couldn't get the vaccine for a number of reasons. When we talk about the vaccination rate against healthcare providers, we pretty much stink at it as a society. Influenza vaccination among healthcare providers has barely increased. It peaked during the 2010-2011 season at 63.5%. The target from the Healthy People 2020 is 90%, and that's where you get that herd immunity. So if 90% of the population was vaccinated, the 10% that couldn't be vaccinated or weren't vaccinated would get the benefit, and there would be much lower transmission. What is found is pretty intuitive, that coverage was highest among physicians and all healthcare providers working in hospital settings. Older healthcare providers tended to get vaccinated more than younger healthcare providers. And interestingly enough, if you were threatened with being fired, you got vaccinated. So near universal coverage, 98%. If it was told to the healthcare provider that you better have a really good reason not to get vaccinated or find another place to work, most people said, I'll take the vaccine. It's not worth the risk of not being able to pay rent. So, however, only 13% of all healthcare providers were mandated to that requirement. So even during the 2010-2011 epidemic, there was not a huge mandate for everyone to get vaccinated. Why is it important for healthcare providers? I think I highlighted it already, but healthcare providers take care of the at-risk patients. We see people in the hospital or in your office generally who are not well. They're sick for multiple reasons. Certainly my population, I'm taking care of some of the sickest people in the country with chronic wounds that won't heal. So I've mandated that my staff in my office 100% has to get vaccinated against the flu, or they have to wear a mask to work if they don't want to get vaccinated against the flu. And by doing that, guess what? 100% of my staff got vaccinated because no one wants to wear a mask from the moment they walk into the office to the moment they leave. The interesting thing is non-medical employees in hospitals can also be problematic. From the dietary worker who hands the patient the meal to the person who's cleaning up the beds, there's all patient contact. If you sneeze, if you expose that person to influenza, you can make someone potentially sick, and in worst case scenario, that can be what leads to ultimate death, is someone who's in the hospital suffering a myocardial infarction now gets influenza. any of us who worked in hospital, you see that happen all too commonly. Someone goes in for one particular reason, they get a complication, and they die of the complication. So it needs to be prevented. The way to prevent it is prevent the spread, and we should vaccinate all healthcare workers as well as anyone who has any patient exposure. It's very difficult because we're transmitting the virus before we know we have it. So it's transmitted for 24 hours before you develop any symptoms. So obviously, you wouldn't go to work very, very sick. However, I also know that most physicians, most nurses are very, very dedicated, and I can almost say that anyone who's working in the healthcare field, me included, I've gone to work with 102 temperature when I definitely shouldn't have, but I feel that my patients are expecting me to be there, so you do what we can. We've all done it. Hopefully we're not transmitting influenza because we all get vaccinated. Okay, next. So 5 things that I want to everyone to take away from today's talk is healthy kids can be hospitalized or die from influenza. Nobody is natural immune. There's no natural immunity to influenza. Hand washing can help stop germs from spreading, but it's not enough to prevent airborne diseases like the flu. We need vaccines. Vaccines work. They're safe. They should be utilized. The vaccines are thoroughly tested, and this is a way to keep the kids in school and keep the workforce healthy is get universal vaccination. So do your part, vaccinate yourself, vaccinate your patients, vaccinate all the workers in your office. Next. If everyone can promise to do these 3 things today, I would say my trek up to Albany was a success. 1, continue to educate your patients and others about the seriousness. Certainly, I encourage everyone to use my story. I was, fortunately, it has a happy ending, but it should scare the living daylights out of everyone. I had a normal, healthy kid who was on death's door, 2 chest tubes, intubated, 14 days in the ICU. And there's, again, in this book, at Cohen's Children's Hospital, which is a tertiary care center caring for cancer kids, the sickest kids in the tri-state area, essentially, I had the privilege of having the sickest child in the ICU. Not something you ever want to hear. Especially me, I knew what that meant. You just don't want to be there. Urge all your family members to get vaccinated, especially with the universal recommendation. Everyone over the age of 6 months should be vaccinated. I really hope that everyone who's coming to this conference is vaccinated, but be a role model. Be able to tell your patients, well, I got vaccinated, because they're going to ask, well, why did you get vaccinated, doc? If you say, well, I'm afraid of the mercury in the vaccine, what's your patient going to think? You're a physician, you're a nurse, you've had lots of education, they don't know about it, but he's not willing to do it, so why are they? So be a role model, please get vaccinated. If we do this, we'll protect more people from getting the flu. If only 1 child life is saved, then I think we all would say we did something very, very beneficial. We can decrease the number of children hospitalized, which obviously is important. And like I said, let's try to save every child that is dying an unnecessary death. If you can prevent it by giving a shot or getting a shot, I think you would do that. Next. I'm here today representing Families Fighting Flu. You can look at the website online. They've got some great tools. I hang some of the posters up in my office because they're very good posters for patient education. They provide remarkable, tear-wrenching stories. So for people who say, I don't need to get flu, it's never going to happen to me, from a 13-year-old, beautiful, healthy girl with no problems whatsoever to my son, there's the whole gamut. So you can show patients, show people that this is serious. Kids do die. Kids have died. Let's not let these children die in vain. Like us on Facebook. Laura Scott, the director. You can follow her on Twitter. And any questions? Next page. She left. If there's any questions regarding Families Fighting Flu, if you want to make a contribution, I'm not here soliciting money, but if you wanted to make a contribution, get information, you can email Laura Scott. She's down in Virginia. She's the director of this phenomenal organization. And I think that's it. Any questions or comments regarding this?
We have a couple of questions. The first is about how many requests for information or presentations does Family Fighting Flu get on an annual basis, and particularly during flu season?
I'm not 100% sure. That would be better for Laura Scott. I know that I probably get a dozen requests a year, and certainly from the end of the summer through flu season, there's many more requests. We try to honor every request. There's about a dozen or so families that are members of Families Fighting Flu, and we have 4 medical advisors and throughout the country. So wherever the requests come in, we try to educate people as much as we can. That was the mission. Or is the mission, I should say.
Thank you. Does Family Fighting Flu, has it done any follow-up research evaluation to assess the relationship of their efforts in communities and the uptake of flu vaccine?
Again, better for Laura Scott, but in speaking to her, I do know that they do some surveillance. The mission of the organization is primarily education, so there is clearly a relationship, and that's been studied between physician education and compliance, specifically as it relates to our role in Family Fighting Flu and education. I'm not sure that we've actually studied that.
Thank you. Does anyone else have any questions? Okay, we're going to send it back to Burlington. Marcia's going to do a brief update on the evaluation and closing. Thanks so much.